It was 6 months ago this week. The pandemic began changing our lives locally as well as for those across the globe. Joy Dukes speaks with Erlanger's medical director about the obstacles hospitals have faced so far, as well as the new challenges in the future.
Yeah, David, I'm told by Erlanger's medical director of infection prevention, Dr. Jay Sizemore, that since the spike in COVID-19 cases we saw here locally just after Memorial Day, that that medical staff members have been caring for anywhere from 20 to 40 patients every day. He says while there's still a lot of uncertainty around what the end of this pandemic is going to look like and how they can continue to move through it, he does believe that we're on the right track.
30 million cases globally, more than 6 million in the U.S., nearly 175,000 cases in Tennessee, and 9,000 in Hamilton County are what the last 6 months of a deadly pandemic have brought on.
We didn't know what to do about it. We didn't know what the most effective ways were to prevent it. We didn't have any effective treatments.
Erlanger's medical director of infection prevention, Dr. Jay Sizemore, says in his 22 years as a physician, the pandemic that began in March has been the medical community's biggest feat.
We've had a couple of bad influenza seasons where things got a little difficult, but certainly nothing like COVID-19.
Though case numbers locally were relatively low in comparison to larger cities like New York and LA, Sizemore says navigating the last 6 months has been a difficult task with no vaccine and no end in sight.
Did have to make a series of adjustments to what we do on a day-to-day basis to take care of patients.
From issues like lack of access to quick and reliable testing.
There was a struggle in April in getting turnarounds for COVID tests.
To a limited supply of PPE from the county stockpile early on.
And the longer we had to wait on a test result to come back, the more PPE we were using.
And even hysteria that stopped many people with other illnesses from going to the hospital.
And people died from delaying seeking appropriate health care because they were scared to go to the doctor's office.
Sizemore says they had to ration resources carefully, but have come a long way from where we started. As local hospitals joined forces with county leaders to develop a plan, he says the mask mandate put in place by Hamilton County Mayor Jim Coppinger was a big turning point.
So there was a very nice, clear correlation locally of when the mask mandate went in locally and decrease in hospitalizations 2 weeks later.
He tells Channel 3 while we wait for a vaccine and hopes things will return to normal, the community is going to have to accept masking as a part of a new normal.
And earlier this week, CDC Director Robert Redfield spoke to lawmakers, just sharing with them and reinforcing this idea that masking is extremely vital. He even said that masking could be a more powerful tool than a vaccine. He also said that he believes a vaccine realistically won't be available until this time next year. So far in Hamilton County, 7,600 people have recovered from the virus. We're now reporting live at home. Joy Dukes, Channel 3 Eyewitness News.
Joy.